Hello, dear colleagues, and good morning. Before starting, I would like to thanks a lot Nestle Health Science for giving me the opportunity to present you a talk on the cause for mobility constraints and a new insight in the treatment of osteoarthritis. Osteoarthritis, this is my disclosure. Osteoarthritis is a degenerative joint disease. It's characterized by pain on movements, joint deformity, stiffness, and sometimes swelling. The disease leads to severe disability and affect the patient's quality of life. Osteoarthritis is one of the main causes of sedentary lifestyle in young adults and contribute to the incidence and progressions of comorbidities such as metabolic syndromes. In 2021, around 600 million people were affected by the disease, representing an increase, a huge increase of 132 persons since 1990. Given population growth, scientists estimate that 1 billion people will suffer from osteoarthritis by 2050, creating inequalities between the countries, but also between individuals in terms of access to healthcare. This is why the FDA recognizes osteoarthritis as a serious disease for which no cure exists. It is now well known that symptomatic osteoarthritis is associated with a higher risk of comorbidities and mortality due to cardiovascular disease. More specifically, osteoarthritis is associated with an increase of risk of obesity, diabetes, hypertension, gastrointestinal ulcers, but also depressions and sleep disorders. Osteoarthritis of the lower limb, mainly the hip and knee osteoarthritis, is also a risk factor for falls in elderly and sedentary lifestyles in adults aged 45 and over, as well as for cardiovascular mortality. Further, osteoarthritis is now accepted that that metabolic syndromes as a whole or each of its determinants taken separately increase the incidence and progressions of osteoarthritis, which contributes to what is so-called the meta-inflammations involved in the pathophysiology of cardiovascular diseases. In addition, depressions and sleep disorders are associated with an increased risk of falls, as is a sedentary lifestyle that is also supported by fears of falling. A sedentary lifestyle is a key target in the management of osteoarthritis, as it is now well accepted, well documented that sedentarity enhance the comorbidities, the metabolic syndromes, but also increase the risk of depressions and sleep disorders, and also the cardiovascular mortality. Therefore, and this is a very key message, is that to treat osteoarthritis properly, healthcare professionals need to treat not only the joint, but also the patient as a whole, including the metabolic syndromes, the mental disorders, the sleep disorders, and preventing falls. The optimal management of osteoarthritis symptoms require a patient-centered strategy, including the management of modifiable risk factors, including obesity, for example, and the combinations of non-pharmacological and pharmacological treatments. Pharmacological treatments, mainly NSAIDs and paracetamol, should be used to facilitate physical therapy and to return to physical activity, and conversely, non-pharmacological treatments should be carried out to reduce the consumptions of drugs with adverse effect. Pharmacological treatments, and I would like underline that, should never be used alone and should always be combined with non-pharmacological modalities. The basic treatment, the core treatment of osteoarthritis for all the patients, regardless the age, severity of the disease, or the health status of the patients, should include education about osteoarthritis, regular physical activity, including structured land-based exercise program, including muscle flexibility, aerobic, and neuromuscular control exercises, and diary weight management if the patient, of course, is in overweight or obese. The pharmacological treatment's objectives are mainly to relieve the symptoms. At this time, there are no treatment that can modify the natural progress of the disease. And the problem is that the options are very limited. All the recommendations are of the scientific societies says that the first-line treatments are topical NSAIDs, while oral NSAIDs, duloxetine, if the patient suffers from widespread pain, depressions, corticosteroid injections, and hyaluronic injections are secondary line treatments. However, and this is a problem, is that a lot of these compounds, including NSAIDs, duloxetine, but also repeated corticoid injections, induce severe adverse effects, and therefore their use should be limited, especially in older patients and those with comorbidities. This means that we need of safe and effective therapeutic alternatives. This is for which we have tested in clinical trials in a randomized, double-blind, placebo-controlled crossover study, treatments based on oral enzyme combinations. And this study was fully managed in Belgium, and this is a therapeutic and alternative treatments to NSAIDs that I will show you now. The tested product contains bromelain, which is a cysteine protease enzyme derived from pineapple, trypsin, a serine protease enzyme isolated from porcine pancreatic juice, and plant flavonoid rutin extract. These enzymes, these oral enzymes, work by acting on alpha-2 macroglobulin and binding these molecules and modifying the primary structures of alpha-2 macroglobulin. And by this way, the cytokine, the circulating cytokines, mainly the inflammatory one, are catched by alpha-2 macroglobulin and are by this way more easily eliminated by phagocytosis. In this study, 45 patients with symptomatic femorotibial osteoarthritis were recruited, randomized, and given either 3 caps of placebo or 3 caps of oral enzyme combination OACs during 8 weeks. After 4 weeks washout period, patient receiving OAC receive a placebo, and conversely, patient receiving a placebo took OAC for a second period of 8 weeks. The primary endpoints were mainly biological one, and this is one of the originality of the study. We have measured in the serum or urine of the patients cartilage biomarkers measuring the metabolism of the cartilage, markers of innate immune response, systemic inflammatory markers, and also cellular pathway molecules, which were identified using chromatographic mass spectrometry. The patient characteristics in terms of age, gender, BMI, blood pressures, pain intensity, and also a KUS score, which is an algofunctional score, were similar, as you can see on this table, in both groups. Interestingly, and this is one of the major results we obtain with OAC, is that IL-10, which is an anti-inflammatory cytokines, were increased by OAC after the 2 8 weeks periods treatments. A secondary important result is that CTX2 measures in the urine of the patients, and CTX2, this is a biomarkers of type 2 collagen molecule degradations, type 2 collagen molecule, which is one of the main component of cartilage. These markers were decreased in the urine of patients taking OAC comparing to the placebo, meaning that OAC can decrease the degradations of the cartilage. Another key important result is that OAC may modify the algofunctional status of the patients assessed using the knee injury and osteoarthritis outcome score. And mainly, OAC improve the pain and the symptom subscore, meaning that OAC may relieve the symptoms of patients suffering of knee osteoarthritis. Therefore, we can conclude that symptomatic osteoarthritis is associated with a higher risk of comorbidities and mortality, and therefore it's important to well manage this disease. NSAIDs, which remain unfortunately the most used pharmacological treatments to relieve OA symptoms, have a moderate effect on chronic pain and are associated with adverse effects, meaning that we have to limit the use of these drugs in elderly people with comorbidities. One alternative, this is OAC, which show not only to modify the synthesis of anti-inflammatory cytokines, but also has a potential disease-modifying drugs, is observed by decreasing microcartilage degradations and improving the symptoms of the patients. Before concluding my talk, I would like just remind you that each September 17th, this is the World Osteoarthritis Day, and if you want to have more information about OAC or about the research on osteoarthritis, don't hesitate to contact me, scan the QR code, and I will answer you. Thank you very much for your attention.